If you're using the Affordable Care Act for your health insurance, you just might lose your health care coverage or face steep cost increases after a lapse in federal tax credits. Congress failed to pass the tax credit extension last week, posing the risk of substantially raising premium costs for hundreds of thousands of Alabamians and millions of Americans. And just tonight, House Republicans approved a narrow package designed to lower health care costs. It will allow small businesses and self-employed people to buy coverage through association health plans in an effort to lower premiums. It will also provide federal funding for cost-sharing subsidies that lower-income Affordable Care Act enrollees get to help lower deductibles. The GOP health care package will be sent to the Senate, but a vote isn't expected before lawmakers leave town for the holidays. The bill passed tonight ignores an extension or a solution to the expiring ACA subsidies. Fox 54's Caleb Aguayo shows us the local impact.
Congress's failed extension on Affordable Care Act subsidies is set to have a ripple effect. If they don't pass something soon, up to 500,000 Alabamians could see some kind of change to their health insurance premiums. In addition, Arise Alabama predicts the rising costs could deter about 130,000 Alabamians, leaving them with no coverage at all. That's alongside rising costs for childcare, groceries, and basic necessities. But the government doesn't have money to burn either. A proposed one-year extension of the subsidies would cost the federal government an estimated $23.4 billion. Senator Katie Britt talked about this in a statement on X, calling the Affordable Care Act an unaffordable system that fails the Alabamians who need it. She's advocating for reform. She said, "I will continue to support healthcare plans that make necessary reforms to the Obamacare marketplace so it's affordable and will benefit those in need." The change to ACA subsidies would take effect at the start of the year. With so many people potentially affected, Robin Hayden with Alabama Arise says it's going to have consequences for everyone.
There are going to be so many secondary impacts of people losing health insurance. There'll be people that we work with and see every day and that we rely on. There is a lot of anxiety. There is a lot of concern. And it's really hard, when you've been paying $300 a month for health insurance to suddenly have to come up with $600 or $800 a month. That's just not affordable for most of us.
The Huntsville hospital system says it incurs about $171 million in unpaid care costs every year, a figure already noting people's inability to pay for care. They said in a statement that if ACA subsidies are not renewed, we estimate that our service area would account for roughly 10% of the statewide impact. They added, "We will continue to work with our federal delegation to support policies that promote access to coverage and positive health care outcomes for North Alabamians." Alabama Arise says they're also working with the federal delegation to bring people's concerns directly to state leaders. In Huntsville, I'm Caleb Aguayo, Fox 54 News.
Four Republican lawmakers are now backing a Democratic effort to extend pandemic-era Obamacare subsidies. That means Democrats now have enough signatures on their discharge petition to require a floor vote on the subsidies. Those enhancements are set to expire on January 1st, but the vote won't happen until later next month.